Okay, so now on to what I'm having done tomorrow. I'm going back to my friends at Innovative Sports Medicine, Dr. Jeremy Reed and Faye Hudson and their staff, who are amazing. This time it's a little bit different. So before, I had posted about having platelet-rich plasma, or PRP, in my hamstrings, which has been a huge success. I'm so thankful I did that. For a little over a year, I would say, I've been having some off and on knee pain, and I've shared with you before that I went in for a consultation to figure out what was going on. And most of my pain was from a Baker's cyst that I had in the back of my right knee. Something of note is that Baker's cysts really don't come on in isolation. They usually form as a response to something else, whether you have an instability, another injury, or a tear in something. That's when a Baker's cyst will typically form. So when I had my diagnosis earlier this year, what they found with ultrasound is that I have a small tear in my MCL, medial collateral ligament. I have some degenerative change in my medial meniscus, not like a full-on tear. I have a posterior lateral corner tear that's pretty significant. So in the back outside corner of my knee, your entire knee is surrounded by a joint capsule, which is just a lot of ligaments essentially that form together that kind of contain the knee. And in the back's outside corner, there's a tear that's allowing too much shift and too much play to happen in my knee, and so that's causing some instability. And I think that's it. I think those are all the injuries. So that's some of the treatment I'm going to get tomorrow. Is there's going to be stem cell injections, and then there may be some combination of PRP. I don't quite know yet, but I will get that information. And then additionally, I have a muscular tear on my opposite side of my left hip in my tensor fascia lata, or TFL, which is right up close to the hip, kind of up to your iliac crest, the bone that if you rest your hand on the top of your hip, that's your iliac crest. So it's just below that. I'm assuming that's probably from compensating for the pain I've had in my right knee. Interestingly enough, with my knee pain, it has not limited my running. It really hurt. It's not too bad right now, but it really hurts mostly with squatting, stairs, any sort of bending down movement. And I do feel the instability. It's not painful, but I can sense the instability. So the reason I share that is that my knee pain is not awful by any stretch at all, but it's been limiting my daily activity. The reason I want to share that, and this would be for my patients, my friends, my family, my loved ones, everyone who's listening. I highly recommend that you not wait to do something about an injury until it's really, really bad and you're desperate. My knee pain has never been a desperate level of pain, but it was enough that I knew something was off and something was wrong, because it wasn't getting better with rest, and it wasn't getting better with conservative measures. And so I knew something else was wrong. And so if that's the case for you, if you are having pain that maybe really isn't awful, but it's interfering with your daily activities, don't wait until surgery is your only option. Go and see somebody about it, and whether that's a sports medicine physician who can really thoroughly diagnose you. That's one of the reasons I go to Dr. Reed, is he is a fabulous diagnostician. He uses ultrasound and can do imaging and diagnose many things. And so while X-rays and MRIs are very valuable, they can't see everything, and you can't move while you are being imaged. And so one of the things that was really valuable in Dr. Reed's office is that when he was taking my knee through different movements, he could see what was happening while I was moving, and he could see that instability and see the gapping in the back outside corner of my knee while he was doing the ultrasound imaging. So that's highly valuable, and then that way he can determine the best course of treatment. So I am going in tomorrow morning, Wednesday the 11th, right? Yes, today is the 10th, Wednesday the 11th. So I covet your prayers. Thank you so much. We'll keep you updated. I'll try and do video tomorrow and give you as much information about the procedure itself and let you know what he's doing where. And then I'll keep you updated on my recovery. So thank you all so much. Have a wonderful day.
Yeah. Hi.
Hi there, friends.
What's going on?
I'm in the midst of getting some stem cells harvested out of my hip, my posterior iliac crest. And Dr. Reed is doing a fantastic job. I feel amazing.
She's 2 ounces into her bone marrow.
Very.
on and you didn't reaccumulate a Baker's cyst?
I don't know what happened.
There's nothing there, is there? Same beautiful clean vessels and,
Yeah.
and joint. That's it.
It's beautiful.
Okay, star of the show. What are we doing now?
We're gonna graft your medial joint line in the backside of your MCL.
Sweet.
So that V there is your joint, and that gray structure in that V is your medial meniscus, which is pushed out a little bit from the joint space narrowing you have. And then that gutter, that black thing just to the right of that V, is some swelling back behind your femoral origin of your MCL. It's a good time.
Let's freaking go.
Makes me happy.
Awesome. It's like, hey, you got a nice hole there. That's nice.
That's awesome.
We're just gonna fill that hole in here in a second.
Cool.
This one's salty. You okay?
Mm-hmm.
Okay.
Totally fine. I see that needle go in there. Ew.
Uh-huh.
That's pretty cool.
Alright, we're just a little bit behind where we need to be, so this way.
There it goes.
A little nummy down into that joint.
Perfect. I like nummy.
Come back out through that. You're just sort of separating your MCL with a little bit of water pressure.
Okay.
Ready. I'm
I'm
gonna give
ready.
you
Let's go. Let's
just
rock and roll.
a few more. 1, 2, 3, pokey. She didn't jump too bad. Dive right into that joint line. That flashes cells.
Cool.
I'm gonna come right back out. Into that MCL right there. And squirt.
Cool. Look at all those pretty cells going in there. Magical.
Wish it
Is this the only spot you got on this side? Is there another on this one?
We're gonna look.
Okay.
Dr. Reed's working at magic.
Playing video games, that's all I'm doing. Don't want to be too deep, don't want to be too shallow.
Just
We want to
right.
be right there, yeah. Okay. Just take us a second to find this spot.
That was so incredibly obvious the last time.
So it looks a little better today.
Which really kind of makes no sense considering I just ran that race, but whatever.
There.
Hello, friends. I'm here recovering at home and feeling really good. A lot of the lidocaine hasn't worn off yet, so it remains to be seen how I'll feel later, but very, very successful procedure and very thankful as of right now that I had it done. So I'll keep you posted. Hello there. So here I am the day after my stem cell and PRP procedure, and I'm feeling pretty good. I haven't had any meds since right before bed last night, and I'm a little uncomfortable at the harvest site in the back of my left hip, but it's mild. I would say maybe a 2 or 3 out of 10. So I'm very grateful that I'm not in any more pain, and my knee doesn't hurt at all, which is crazy. And then the spot where he did the injections on my left hip for PRP also doesn't hurt very much. So I'm very thankful for that. So I was going to share, because I've had a lot of people ask, how long am I going to be out, and what is the recovery like? So I'm just going to share with you my restrictions just in case you're curious. So I'm not allowed to bathe or shower for 48 hours. Ew. But that's okay. I'll survive. And then no soaking in any tub or hot tub for 5 days. And then I'm supposed to minimize how much I'm up and on my feet for the next 5 to 7 days. And so they really recommended using crutches to limit my weight bearing. So I've been using crutches to get around. And then I can start returning to normal activity from days 6 to 8, which is awesome. But that time, really what I'm supposed to do is a little bit of stretching, not full yoga yet, but some stretching. I can do abdominal work, and I can do some upper body lifting at that point as long as I'm seated. So that's between days 6 and 8. Then, as soon as 2 weeks after the procedure, so for day 14, I can start to ease back into my normal exercise routine, i.e., walking, yoga, lower body exercises, and running. So I will be very, very slow to ease back in, but that's as early as 2 weeks. So it's awesome that there's that little downtime. So pretty awesome. Just another very interesting thing is that I can't use any heat because we wouldn't want to increase swelling. And also, I'm not supposed to take any anti-inflammatories, and I wasn't supposed to do that ahead of time. So no Aleve or ibuprofen, and the reason is those are anti-inflammatories, and the stem cells and PRP procedures are supposed to be produce an inflammatory response. So you want that to happen. You want those healing factors to be brought into the area to encourage healing. And so you don't want to slow that process by introducing anti-inflammatories. So I can take Tylenol and then the meds that they prescribed for pain. But I'm not supposed to do that for the next 4 weeks, interestingly enough. No anti-inflammatories, which is fine, especially considering I'm not in any pain. So that's a little bit about my recovery, and that's it.